topic that I'll be discussing today is mental health issues among college students. So some background information on this: mental health issues among college students can be caused by undiagnosed disorders once they enter into college. So them not knowing how to cope with what they're experiencing, or they may not know what they're experiencing, can be worsened by the college environment. So their social pressures and then academic pressures. It can also be caused by different stressors in life, so their academic pressure, especially if they need to maintain a certain GPA for scholarships or to even stay in their program. They can also face financial pressure on how they will pay for their school, or some worry about student loans, or they're not receiving help in paying for their college and they have to pay for it on their own by working jobs. It can also stem from family problems, so if you don't have a good home life or relationships with your family, but also even if you have family deaths and family members that are close to you. And then societal issues, so anything that's going on in society can also affect the student with mental health issues. It can also be worsened by the mentality that higher education is required for all to have a better quality of life. This can push students to pursue degrees that they're not interested in, or that they don't want to make enough money for their living. So why is this trend important? This is an increasing issue. It can also affect the health behaviors of the student who's suffering from mental illness. It can cause them to turn towards substance abuse to help cope with their mental health disorders. It can also affect their physical health if they aren't prioritizing themselves. They can also be a harm to themselves or others. And then also the dropout rate. So as you can see in this photo, nearly a third of college freshmen drop out before their sophomore year. And then the overall dropout rate as of 2019 is 40%. Who's most impacted by this issue? So who would be most impacted would be the students who suffer from mental health issues themselves, and it can kind of cause a domino effect. So it can affect their family members, especially if they don't know how to help the student cope with what they're dealing with, and they can also not know how to help them. And then those who work with the student who is suffering from mental health issues, so professors or coaches or advisors, once they know that the student is experiencing these mental health issues, it can cause them to feel helpless or not really know how to help the student. And then this topic, how it's viewed by the media. So one view is that the issue should be fixed, and these are the organizations or people who want to provide support and resources to the students who are suffering from mental illness, and also to the family members or friends who are close to the student. It also brings awareness to the topic of mental health issues, and then also those who want to destigmatize it and not place the students in a box once they are diagnosed with the disorder. And then the next one would be that the issue should be ignored. So a lot of students are taught to keep their mental health issues private, so they don't really know how to reach out and ask for help when they need it. And then there's no education for it, which can also impact the student and those around them, because they don't know how to help themselves or individuals who suffer from the mental health issues. Organizations that help students who struggle with mental illness. So the National Alliance on Mental Health, their mission is to provide advocacy, education, and public awareness for those who struggle with mental illness, and they have a program called Stigma Free on Campus, where you can take a pledge to help destigmatize mental illness, and then it helps provide resources to those who are suffering from it, and then those who know someone who is suffering. And then the American College Health Association, so their mission is to provide advocacy, education, and research to students who suffer from mental health issues. And they also provide programs and resources to mental health professionals, college professionals, and then the students who are suffering from mental health issues. Organizations that can hinder the mental health issues among college students. So academic honor societies, just to pick one and focus on it, I chose Phi Beta Kappa because it's one of the most prestigious. Their mission is to honor, advocate, connect, engage, and recognize students. This can put academic pressure on the students because often they need to maintain a certain GPA to stay in, and it can cause a very competitive nature among its members. And then Greek life, to choose one, I chose Alpha Gamma Delta. Their mission is to inspire the woman and impact the world, and Greek life can put financial pressure on students by having them pay dues just to help contribute towards their chapter and to help their standard of living. And then academic pressure, some students may need to maintain a certain GPA to stay in their chapter. So how can college students help the trend of mental health issues among college students? They can provide support to individuals who suffer from mental health issues. They can also refer themselves or individuals that they know who are struggling to resources such as counseling. They can use their social media platforms to help advocate and educate others, especially if they are struggling themselves, to let students know that they aren't alone in their struggles with mental health. And then in the future, I would like to see less of a stigma around those who suffer from mental health issues. I would like to see required accessible care. Not every college provides free counseling to their students, and once it's no longer free or they have to resort to off-campus resources, it becomes less of a priority to them. And then also, I would like them to face less pressure, like in the classroom setting or even from the environment around them. And my major helps me with bring awareness to this issue because I major in biology and pre-health, so it's very research-based, and I've been taught problem-solving skills, and I have a basic knowledge of psychology, so that could help me become a more credible resource to those who are struggling, and then I can help others understand like the how and the why behind it. And this is my Works Cited page, and that's all for my presentation.